Anyway, surgeons at the Cleveland Clinic are sharing details of an historic operation.
Doctors performed the first ever uterus transplant. The groundbreaking 9-hour surgery took place last month on a 26-year-old patient identified as Lindsay. Lindsay told reporters today she was told at 16 that she would not be able to bear children. Doctors say it will be at least a year before Lindsay can get pregnant through in vitro fertilization. Fascinating. Dr. Zorba Paster is here tonight to talk about this with us.
And we're also taking your calls. If you have a medical question, call the number 270-9933. If you're on the line, stay there. We'll get to you in just a second. Let's talk about this uterus transplant.
Oh, it is. It's very, very exciting. So think about it. We have heart transplants. We have kidney transplants, very common at the University of Wisconsin, liver transplants, and now we have a uterine transplant, you know, so that this will maybe in 5 or 10 years be a big issue, especially for women who can't have children. So here it is. They explained this was a young woman at the age of 16, told she had a uterus that would not bear children, and now she's going to be able to bear children. Probably that is a great step forward. And I just think it shows you what technology is doing to our lives. It really is enriching it.
Is there any limit to this?
Well, you know, you always wonder where the limits are. And frankly, the limits keep on stretching more and more and more. We're living longer. We're healthier. There's actually been a significant drop in Alzheimer's and dementia over the last 20 years. We thought there'd be an increase. We're just doing a better job medically, technology-wise, and lifestyle-wise. So, yes.
All right. Let's get...
Sky's the limit.
The sky is the limit. Let's get to the phones. We'll start with Nelva in Portage. Hi, what's your question?
Hi, I just wonder what the meaning of congenital hypothyroidism without a goiter means.
Well, hypothyroidism means low thyroid, and a number of men and women suffer from it, women more commonly than men. Treatment ultimately is to take artificial thyroid medication, something called Synthroid, levothyroxine, and basically this really cures the problem, and you have to take it all the time because your thyroid is just not making as much as it could have. Now, congenital means you were born maybe with a low thyroid. There are a lot of conditions that can actually cause that throughout life. Take your medicine and you can function totally normally.
All right, that's very good to hear. Let's go to William from Poynette. Hi, William, what's your question?
Yes, I had a heart attack 1 year ago, and I'm taking 2 different kind of medicines. I'm taking LIPITOR and LOSARTANPOT.
Okay.
And I'm coughing and I'm choking.
Do you smoke, by the way?
No, I don't. 12 years ago, I quit.
Good for you. Quit 12 years ago. That is always a good step forward. Well, first of all, you're on a drug to lower cholesterol. That doesn't cause coughing. The other drug, losartan, that you're on, very rarely causes a cough. Can cause a cough. There's another group of drugs called ACE inhibitors that really cause a cough. Losartan, in a rare case, can cause it. I think you ought to talk to your doctor. You may want to be on a different medication and do a test run to see if the losartan is the issue. It does it in rare cases, maybe 1 out of 500, 1 out of 1,000 people who take it, but you might be that 1 out of 500 or 1 out of 1,000. Call your doctor.
There's a lot of different drugs that can do the same thing.
And don't stop your drug without talking to your doctor. That's important.
All right. Amy in Madison. Hi, Amy.
Hi.
Hi, what's your question?
My question is about acid reflux disease. They've given me all kind of medication and everything to try to treat it, and I still get it.
It's a big problem. Acid reflux has always been a problem. There are a group of drugs called proton pump inhibitors, such as Prilosec. In a generic, it's the most common thing on the market, inexpensive, 20 milligrams twice a day is the maximal dose. And then there are older drugs called Zantac, generic, also over the counter. Sometimes a combination of both pills will make a difference. Or you don't eat after 6 o'clock in the evening. That makes a big difference. Make sure you stop all alcohol, especially any alcohol in the afternoon can make a difference. Coffee, if you stop it, makes a difference. Or the old-fashioned way, you elevate the head of the bed with blocks so that basically you've got a little bit of stomach acid going down your stomach instead of going up your esophagus. That can make a difference, too.
Oh, that's good. Really good advice. Yeah. Let's go to Mary in Portage. Hi, Mary. What's your question?
My question is, if you were given a colonoscopy and they observed a polyp or some polyps, why would they not take the polyp out?
Well, when you have a colonoscopy, they usually do take the polyp out. They take the polyp out, put it in a laboratory, see whether it's precancerous or not, and that determines how often you need to get a colonoscopy after that. Some are benign. They don't have any tendency towards cancer and some are not benign. So I don't know why they didn't take a polyp out, because our gastroenterologists, when they see a polyp, they remove a polyp. When in doubt, take it out.
Should have been embroidered on a pillow. Thank you, everyone, for calling. We're out of time. We'll do this again very soon.
Yeah.
Zorba, great to see you.
Great to see you,
to see
Zorba.
you
Thanks for
guys.
coming in today.
My pleasure.
All right. We'll